Electricity, you can't hear it, you can't smell it, you can't see it, but within 0.5 seconds, it has the power to stop your heart and kill you. This is Pursuit of Medicine, and today we will learn not only the effects of electricity on the human body, but how a forensic expert can prove electrical fatality in the court of law. Let's say that we have got an innocent person over here who accidentally touches a live electric wire. What will be the four things which will decide the extent of injury this person is going to face? The four things will be: first thing, I'll start from here, is the time duration in which he is holding the electrical wire. Second thing is resistance of the body, how much the body is resisting the passage of current. Third thing obviously will be the current itself. Lastly will be voltage. Now students get confused between voltage and current. So always remember that voltage is the driving force. It is the pushing force of the current. Obviously the current matters. More is the ampere of current, more is the injury. But voltage is what pushes the current into the body. Now, when I speak of resistance, it means the epidermal skin layer, because it's this outermost skin layer which is giving most resistance to electricity. Virtually everything below that is not significant enough to give resistance to electricity. And always remember one thing is that dry skin gives maximum resistance to electricity, whereas wet skin, if the skin is wet, there is almost zero resistance to electricity, and therefore this is very fatal. Wet skin gives zero resistance to electricity and is very fatal. This is a skull diagram which I am drawing, which means dangerous. So wet skin gives zero resistance, dry skin gives maximum resistance to electricity. Now there are two types of currents. First is alternating current and second is direct current. Which one is more dangerous? Alternating current is more dangerous. Why alternating current is more dangerous? Because it induces tetanic muscle spasm, the famous hold on effect, where if you hold on to a loose electric wire, you cannot leave it. You're continuously contracting, and you cannot let go of the source of electricity. Whereas what does direct current do? Direct current many times produces a single violent muscle contraction, and because of this the victim is thrown away. So what you need to remember is that alternate current produces hold on and kills silently. It produces kills silently, whereas direct current throws, and therefore since it throws, it is more dramatic in nature. So direct current is more dramatic, whereas alternating current is the one which is killing silently. More dangerous is alternate current. Alternate current is more dangerous than direct current. See, I told you already, dry skin is the best resistance against electricity. As you go deeper from the skin, if this is the skin, if you go deeper, there are blood vessels. Okay. And what does these blood vessels contain? These blood vessels contain Na plus, Cl minus, K plus, okay, calcium ions. All of these are very good conductors of electricity. Okay, good conductors of electricity. So once if electricity starts coming from here, it starts entering from here. The first barrier is the skin. Skin is the biggest barrier, but once it passes through the skin, goes deeper, and if it is reaching the blood, then it is game over, because blood is filled with all these kinds of electrolytes which are efficient in carrying electricity. Now we are coming to the most important slide. This is the pathognomic of electrical injury, the Joule burn. This is a small injury. Many times it could be 1 into 1 centimeter, also so small, and this is almost pathognomic of electrical burn. Okay. Now look at the raised margins. Look at these margins which are raised, and You see it is almost having a collapsed umbilicated center. The center is depressed, margins are raised. And if you see around the margins, around these raised margins, you see an area of paleness. See this area is area of paleness. This is also very pathognomic of electrical damage. Why? This area of paleness represents the arteriolar spasm. Okay, it is this arteriolar spasm which is causing this paleness. Burns, if it was a burn injury, thermal burn injury, there will be hyperemia. There will be hyperemia in the borders of thermal burn injury, but there is no hyperemia over here. Instead, there is paleness. This paleness is what differentiate between thermal burn and electrical burn. Now, let us understand how this injury happens, how exactly this injury is produced, where the margins are raised, the center is depressed, how it happens. It happens via a step of process. I'll go step by step. First step, the skin touches the electrical conductor. There is a firm contact. Now skin resists the passage of electricity. Because skin is resisting this passage of electricity, heat is generated over here. This generated heat causes the tissue fluid to boil, and it causes the appearance of a raised blister. Now, as the current goes inside, once the current goes inside the skin, what happens is the heat cools down, and after this heat cools down, the blister which is formed, this blister collapsed, and this collapsed blister gives this appearance, this depressed appearance. But the margins, they remain elevated. The central part is collapsed. That is why we get this characteristic appearance which is called as Joule burn. And always remember, around the raised margins, if these are the raised margins, around the raised margins, you get a pale areola, which is this area of paleness. And that is because if this is where the burn is happening, or this is from here where the electricity is going, around the place which electricity is going, there is arteriolar spasm of arteries. So the spasm of arteries leads to this paleness. Let's again revise this step by step. First, there is a firm contact. By then, step 2, there is thermal conversion. Because of the resistance, there is heat production. Remember, wet skin does not give resistance. So in wet skin, you will not see this Joule burn. Okay, Joule burn is only seen when the skin of the victim is dry. So second step, thermal conversion, steam generation. That steam generation happens because the tissue fluid boils. Blister formation. Then lastly, as there is cooling, the blister collapses and leaves the umbilicated crater formation. See this crater formation. Now over here in this diagram, see the appearance of this injury. I'll say this injury number 1. See the appearance. This is the classic Joule burn. But now focus on this injury. The appearance is different. Injury number 2. The appearance of injury number 2 is different than the appearance of injury number 1. Why is that? That is because injury number 2 is a spark lesion. What is a spark lesion? Spark lesion is where the skin does not firmly holds the conductor, but instead, if this is the conductor and this is my skin, there is a gap between the conductor and the skin, and the current jumps. See here, the current jumps. So in such cases, there is no classic Joule burn, but there is the keratin melts. The keratin of the skin melts. So by looking at the hand of this victim, we can make out that this injury is due to firm contact. This injury is due to firm contact. This is a spark lesion. This is due to spark, whereas this is also due to spark. So Sparking happened here and here, but the firm contact was here. This is the inference you can get. Now, in electrical fatalities, in the autopsy, what we see, the finding we see is generally very small. We see this kind of Joule burns, we see. This may be the only finding you see in autopsy. So, how does death happen? What you see externally is very small, one or two small lesions. How death happens? There are three ways in which death can happen in electrical fatalities. First thing is electricity enters, whenever the electricity enters the body, it always travels the body and has an exit. Generally, by default, this exit is the ground. So, electricity enters via most commonly the hand and exits by the foot. But if the victim, let's say in the first scenario, let's look at this image. The first scenario, he might be holding a wire. This is a wire from one hand, and if he is holding a metal tap, okay, a metal tap in the other hand, then electricity is going to enter from here. And if he is holding a metal tap, it's going to exit from here. But generally, it enters from one hand and it escapes through the ground. So, the path traveled by the electricity, this is the most common path. It travels from here and goes down, escapes through the foot. What happens in this path? First thing is that electricity passes through an important structure. That structure is the heart. It passes through the heart. And remember, even 80 milliampere of current is is capable enough to produce VFib, ventricular fibrillation, and therefore ventricular fibrillation can cause death. Second, the electricity passes not only through the heart but also through the muscles of respiration. The muscles of respiration, the diaphragmatic muscles, the intercostal muscles, and it can cause respiratory muscle paralysis. Respiratory muscle paralysis. First thing, it can pass through the heart, causes ventricular fibrillation, pass through the respiratory muscles, cause respiratory muscle paralysis, stoppage of breathing. Then, lastly, current can pass from the head. Current enters from the head, goes down, escapes from the foot, and it travels via the brainstem, where it causes paralysis of the centers of respiration and the centers of heart rate. Now, sir, how can current enter through the head? Generally, people hold wires by their hands. This is the most common route, current entering through the hand, or by mistake you step on a loose wire. That is also possible. But how can you touch the wire on the head? Who is stupid enough? These are not stupid people. This is the method by which generally electrical workers, people who climb on electric poles and work on fixing electricity, electrical workers generally are most affected by this method, where electricity enters through their head and causes brainstem paralysis. Again, revising the three mechanisms of death. First is ventricular fibrillation. If the electricity passes through the heart, if the electricity passes through the muscles of respiration, it can cause tetanic asphyxia. Lastly, if the electricity enters the head, goes down, this happens in electrical workers. It causes brainstem paralysis. So, the three forms of death are ventricular fibrillation, tetanic asphyxia, brainstem paralysis. Now, since there are entry wounds, in some cases, this is not in all cases. In some cases, you may be seeing exit wounds, and exit wounds are generally on the foot. And you can see over here that the margins are everted, and it feels, you can literally see over here that the electricity, the current has come from the inside out. So there are also exit wounds, and exit wounds are not only present on the foot, but same exit wound will also be found on the footwear. Okay, many times you will see the same exit wound in the same spot on the footwear also. Now, whatever we have discussed till now, all of that was for domestic electricity. If we go to high grade industrial voltage, the scenario changes. In low grade domestic voltage, what you see is Joule burns and the external findings are minimal. But in high voltage injuries, what you see is this. This is called as crocodile skin. These are generally high voltage has the power of sparking. More voltage, more is the power of sparking. So these are generally flash burns and they cause crocodile skin. See, this is an example of a person who jumped on an electrical railing, and you can see the crocodile skin appearance. There is massive damage and massive carbonization of the tissue, and if you see throughout his body there are metal deposits throughout the body. So how does crocodile skin actually happen? If I take a empty slide, I explained you that spark lesions, small spark lesions, and what crocodile skin is actually multiple spark lesions. What crocodile skin is multiple spark lesions, and these spark lesions are coalescing. They are coming together. Coming together of multiple spark lesions is nothing but crocodile skin. Over here, you see this image. You see this image. This image is of crocodile skin. This has multiple spark lesions coming together. Then you see a single spark lesion. This is a single spark lesion. This single spark lesion multiplied by 100 times will give this appearance. It's going to give this appearance. The forensic pathologist, what he must do is he should first break the rigor properly, because electricity causes muscular contraction. The person, the dead person is generally in massive flexion. So the arms are flexed like this, and you have to break the rigor forcibly and expose the hands completely and examine for entry wound. Once you have found an entry wound, examine for, look for any exit wound. Then you keep these samples and look for metallization. You can store the skin of from the entry site. If there is an exit site, store the skin from exit site. If metal deposits are present at the site of entry and site of exit, that is a definitive proof that this is an electrocution. That is how you will prove it in court that the death is due to electrocution. Okay, that was a short video on electrical fatalities. If you are watching till here, thank you so much for watching. Thank you so much for contributing to this channel. All the best. Take care.